We want to talk about GPAP, the Gay Parenting Assistance Program. So I have here, why don't you come and join me already? So GPAP is the Gay Parenting Assistance Program. It's one of the major reasons we created Made Having Babies. And I always tell people that if they, if somebody came down from Mars and just observed what we do on a day-to-day basis and asked what is Men Having Babies about, they would say we're a financial assistance organization that also does some conferences, because really the vast majority of our resources and our, certainly our budget is dedicated to that. The net revenue, the net profits we have every year are going into those cash grants. So I have with me Laura, which you already met yesterday, and she does most of the case management, and we'll explain in a minute why we need that with GPAP recipients. And we have Kat here that does a lot of the the applications processing and a lot of the communication we have, especially with stage 1 people. So what is GPAP? So first let me say that the reason we created GPAP is because we think that it's wrong that it costs so much, and we're trying to create some, loop back here from the industry to the community to make it more affordable. So one way we're making it more affordable is more transparency. We talked about that. And now we have 2 tiers of assistance. And let me explain the first tier, and then I'm going to have Laura talk about the second tier. So the first tier is what we call the journey booster. The notion here is that that's not going to allow you if you're completely, it's outside your range. But we just talked about the fact that people tend to underestimate how much it's going to cost them, that they might need to have a contingency pot somewhere. And this is meant to help you save maybe $20,000 of your costs. And we do that by access to discounts. So we have even more than providers now that are partnered with us. They're the most reputable ones that come to our conferences. I think with one exception, all the platinum and gold providers we have here are part of GPAP. And on our directory, you'll be able to see an exact list of how much discount, the percentage of discount that they offer if you are eligible. So once you're eligible, we'll talk about in a minute how, you can just go there, and we have a form, and that form is open to all of you. It's not just to GPAP people. We have a referral form or consultation request form on our website that once you are eligible, or if you're not, you're not eligible, you're not even applying, one way or the other, you can go there, and in one click or several clicks, you can send a request to have a consultation with up to 8 providers at a time from a list of almost 60. So, because otherwise, once you have a provider you're interested to working with, you would have to go to their website, and many of them have these intake forms, provided, there especially for this reason. We looked at all those forms and created a universal one, and they all abide by it. If you do that, they're not going to, I hope so, ask you to fill another form. So you choose who you work with. You see on that list who's providing what. Of course, you'll realize that if one provider is offering 25% and the other 20%, it doesn't mean that you're going to have lower costs with the one providing 25%. The gross is also important. You need to see what 25% is from. We mentioned before that not all agencies, for instance, have all-inclusive services. The attorney might not be part of the package, so think of that you'll need a separate attorney. We have also attorneys on the list that are providing GPAP discounts. So it's important to understand that those are not retroactive. What does it mean? If you've already signed the contract with one of these providers, and let's say you're already sitting here and you didn't know about GPAP, and you signed a contract, and now you go and you apply and you are accepted to the program, that provider most likely is not going to give you those discounts retroactively. Doesn't hurt to try, but they're not obliged, based on their pledge agreement with us, to give you this agreement, to this discount or pro bono services, we'll talk about in a minute, if you already signed a contract with them. We accept these applications year-round. You are approved within, if not days, then a week or 2. I hope, now that we caught up with the backlog. There's a lot of demand for this. So this is stage 1. It's important to mention that it's not just agency clinics and lawyers that you get benefits from, but we also have a wonderful relationship and agreement with a large manufacturer of fertility drugs, EMD Serono, and they manufacture, luckily, the most expensive drugs that the egg donors need. Egg donors need more medications than the surrogates, and if you are approved to stage 1, you also get 25% off of these medications. That could save you another couple of $1,000s. And then we also have 2 national pharmacies, Integrity RX and Mendel's. It's all on our website. There's a section called Fertility Medications Benefits. And once you're approved, they're also going to give you some discounts of the medications that EMD Serono does not manufacture. We have some other third-party services that are discounted for stage 1 and stage 2, including GenePeaks, the genetic testing, some escrow services, etc. It's all on our site, or will be soon if they're just joined. So I'm going to hand this over to Laura now to talk about stage 2.
What we do is we look at everybody who is in the stage 2 process for that year in that class, and we kind of match them with a surrogate agency and a fertility clinic that would just best match with them, as well as make it work for everybody else. So we would match you with your specific provider. Again, it's not retroactive, so if you've started...
What's important to say, it's free services, it's not a discount,
yeah.
It's also cash grants.
Right, but the cash grants comes from us, which we would do jointly together with the escrow. It's not retroactive. The applications are annual. It's not this. You don't apply and get accepted within a few days. It's something that is a big process, and it can take some time. So waiting is something that is the hardest part of this. But stage 2, you do have to wait, unfortunately, just to make sure that we get everything working properly and have it covered, so that when we give you your budget, which we create to help give you an idea of what it's going to cost you, that you are basically covered. But to know what your fees are going to be, that will change. That's something that's very important to know. But at least you have an idea of what it will cost you, and it will be significantly less. It is all reviewed by a grant committee that has to do with where the money comes from that we're going to be giving to stage 2 applicants and who gets approved. And then again, we have Lisa, who is not here with us today, but she was here yesterday out front. She is the financial manager, and she creates the budget for you. So it's a teamwork that we all do together. We work with you from start to finish. If you have any issues with your journey, if you have any issues with anything at your agency, or your questions about egg donation or surrogacy, we help you answer that. So we really handhold you a lot more in stage 2 than we do in stage 1.
And just to give you a sense of numbers, we have well over 150 people who are accepted to stage 1 every year, whereas we have between 14 and 20 couples that decide not to move forward with stage, that are accepted to stage 2. So if you're stage 1 and you're accepted, then you can move on and start your journey. If you know that that's not enough for you, and if we approved you, if when you got approved you were told that you're also eligible for stage 2, then you can apply for stage 2, which is the more direct and comprehensive assistance, and that happens only in July and August, and that takes us several months. And by the time you get approved, then we really take you through this. We're partners. All but the fact that you get to keep the child on your own. But otherwise, we're partners because we are part of, we sometimes, as we said, we actually give money, not just the free services, but the free services come from the same providers. So those are very generous providers, reputable because we don't use all the pledges that come our way, because we're part of this. We're not going to suggest you work with an agency or clinic that we're not sure it's going to work out, because if it doesn't work out, we're in it with you until the end, until you're successfully a parent. So we're going to suggest a clinic that works well with the agency. If there's no lawyer there, we'll suggest a lawyer as well. We'll try to maximize the value of the free services, and then we're going to supplement your self-funding, because there needs to be self-funding here. We're going to supplement that with the cash that is needed to get to what is needed, to the level that is required to supplement the pro bono services. And if there are contingencies, we pool the risk. We have a pool of contingency, money we put aside. And not all of the 20 couples are going to have twins. Not all of them are going to have bed rest. Not all of them are going to need a second try. So this way we can budget more effectively for the group. I'm going to ask Kat now to talk about stage 1 application criteria.
Hi everyone, I'm Kat, and I'm so excited to be part of this organization and happy to see all your smiling faces here. I can't wait to see all your applications come through. So first off, we have several criteria for the application process. You need to be a gay man or trans woman. Also, we do accept applicants that are from couples as well as singles. We do take into account incomes and adjust based on your region and age, because all of those play into how our income works for us. At least one of the applicants needs to be between the age of 25 and 50. No existing children. And if you are a couple, we do require that you have 2 years minimum cohabitation. And we do a criminal background check on all applicants. And we receive applications from residents of the U.S., Canada, Israel, and several European countries. And so I am the face that represents where your applications go to, and I'm always here. You can find I'm accessible by email. If I reach out to you, my phone number is on there. So I am so happy to help you guys launch your journey and work with you, and I'm just so excited that you're all here. So thank you so much.
And let me say that there are, of course, very frequent questions asked, including what is the income threshold? And we do not publicize the income threshold. The reason is, first of all, it's something that gets highly adjusted. We look at the cost of living index in your metropolitan area. If you're from another country, we look at that as well. So you could be making a certain income in one area and be eligible in another and will not. We also adjust it by age. What it means is that if you're a couple and you're making, for instance, I don't know, $90,000, and you're both 25, you might, but you live in Detroit, you might be accepted, but you might not be accepted. But if you make that money, amount of money, and you're older, or you're older and you live in New York, for instance, you will be accepted. So what I can tell you is about 65% of the people who apply to stage 1 are eligible. So we're not talking about poverty levels. We're talking about reasonable incomes, and they're still eligible. We arrived at this income level by a survey we did among the providers that are part of GPAP to see what they would consider reasonable, and I think it is reasonable. And some of the other, so stage 1, there's no discretion. We don't have a committee. We don't have to, look into, you don't have to tell us if you had hardships or some special consideration. It's just if you qualify based on those criteria. Stage 2 is a different story. You would have had to pass a low level of stage 1. Some people pass stage 1 and we tell them you're only available for stage 1. We will not invite you for stage 2. Others, we would tell them up front, you're available for stage 1, and if you're interested, this coming July 1st, we'll invite you to apply for stage 2. If you choose to do that, then we ask for more lengthy application form. We look at things such as health statement, not because we want to judge you, but we need to know certain things. They will have effect over who can help you and how much it's going to cost. We look at your assets, not just at your income. There's a psychosocial evaluation. We have a social worker on staff part-time that does both evaluations as well as provide some of the support later on for stage 2. And we require to have, if you're from outside the United States, let me just state, we require to have an LGBT association or the equivalent in your country that is teaming up with us to help with some of the screening. We can't, We're not so fluent in Dutch, for instance. So that's both stages, both levels of assistance. There's also fertility medication assistance as part of stage 2, etc. But we manage those things for you. We are with you. So stage 1, more self-help once you're eligible. Stage 2, very hands-on, take you through the entire process. We have 19 babies, I get goosebumps. 19 babies are already born through stage 2. To people that are in military service and are social workers and teachers and you know, starving artists and that would just never be able to afford this. So they might only have $40,000 that they could, you know, put together. You know, we can help them under these circumstances in stage 2. We wish we could help more people. Part of the reason we can't is that we have enough pro bono services. We don't have enough money. So if you're sitting here and saying, I'm very glad that I'm not going to need this assistance, and if your generosity inspires you, we have donation forms in the front. We would absolutely welcome donations. Every additional dollar that we get in donations help us stretch, you know, our ability to help more people